Okay, so this week we're going to be talking about abortion. And before we get into the details, I just want to lay a few ground rules. So, first is we're not going to actually use our time in this course to debate the ethics or the morality of abortion. So, this is something that many people feel very strongly about, and I want to honor that. And I also want to acknowledge the fact that statistically, it's likely that there are people in this class who themselves have had abortions. So, we're coming from lots of different perspectives. And where you land on this issue for a lot of people largely depends on when you feel a zygote becomes a person, right? So when egg meets sperm, is that a person or is it not, right? There's some religions that say that life starts at conception, so that one fertilized egg is granted personhood. But there are a lot of folks who feel like, well, what's to say a cluster of cells is a person and has a soul and is entitled to all the rights that someone who is a born person has. So we really can't know the answer to that. So obviously, if you think that an embryo or a fetus or a fertilized egg is a person, then you would believe that ending a pregnancy is equivalent to murder. But if you think that that's not a person until they've been born or perhaps later in the pregnancy, right, then you would not see that as killing a person. You would see that as ending a pregnancy. So there's no scientific answer to this question of when sperm plus egg or a fertilized egg or a zygote becomes an actual person. So therefore, we're not going to talk about this, right? That's personal philosophy. That's your own belief system. That's religion. Those are things that are outside the purview of this course. So we're not going to debate that. What we are going to talk about are some facts. So I'm going to educate you about the history of abortion worldwide and in our country, currently available methods, and then some data on who gets them, when, and why, and what do we know about measures that can influence abortion rates. The final thing I want to say is that this topic can be emotionally difficult for some people. So take your time with it, be kind with yourself, and just do your best. Okay, so now we're going to get started on the history of abortion. And first of all, we have to define it. So abortion, just as a general term, means the end of a pregnancy by the removal or expulsion from the womb of the fetus or the embryo before viability, because obviously if it's after viability, then we would call that childbirth. So this can happen spontaneously, which the lay term for that is miscarriage. So technically a miscarriage is called a spontaneous abortion because it's a spontaneous end to pregnancy. Or you can have an induced abortion. That's what we usually think of as abortion, sometimes also called a termination of pregnancy. And there are a couple of different methods by which you can terminate a pregnancy. So I'm just going to use the term abortion for the rest of this week, but please know that I'm referring specifically to induced abortion rather than spontaneous abortion, which is a miscarriage. So what do we know about the history of abortion? It's actually been around a really long time. So much like efforts to prevent pregnancy have been along for a really long time, so have the means to get rid of a pregnancy if it was undesired. So in ancient Egypt, it was an accepted practice per their mythology and a spiritual practice. The pregnancy was not a person, so they used a variety of herbal drinks and vaginal douches and suppositories, things you would place inside the vagina to cause the uterus to expel the embryo or fetus. And in ancient Greece, the great philosophers, both Plato and Aristotle, felt that abortion was a perfectly acceptable tool for population control. And they did not believe that the fetus had a soul or a right to life. And so Hippocrates, the famous ancient physician, the guy after whom the Hippocratic Oath is to whom it is ascribed, he recommended a 3-part regimen, which I think is hysterical. So purgatives, so things like castor oil that make you have uterine cramping and diarrhea. and then some herbal pessaries, which would be herbs you would place up inside the vagina. And then you were to carry heavy objects and jump up and down a whole bunch. So I find that pretty interesting. And then in ancient Rome, again, they did not believe that the embryo was a separate person. And so abortion was also very common then. And they knew lots of things that could help create an end to that pregnancy. So by the early 1800s, here in the United States, as well as in Europe, abortion was common and very easily available, usually provided by midwives and herbalists. And in fact, even most churches said it was fine as long as it occurred before quickening. And quickening is the name given to when you can first feel the baby move, which usually happens around 14 to 16 weeks or toward the end of the first trimester. So even the churches didn't believe at that time that the soul kind of entered the fetus until you were several months along in the pregnancy. So in 1847, then, the American Medical Association began a new campaign to outlaw quackery. So they had really had it with these midwives who didn't go to medical school, prescribing things for women. And so they said, no, this is immoral, this is dangerous. And so society at that time also started to become much more conservative, and abortion started being outlawed, eventually being illegal in all United States by 1870. So you may remember the Comstock laws that we talked about in regard to contraception, because they made that illegal. They also made abortion illegal, and these were passed in most states in the 1870s. So in most states, but not all, because some of them had started to reverse their laws in the 1960s, abortion was illegal. But that didn't mean it wasn't happening. And so one of your immediate assignments is to watch a documentary about the 1950s and 60s and into the late 60s when abortion was illegal. But what we still found is that women who were unhappily pregnant, right, would do anything to end that pregnancy. And so what happened is many women got abortions from unlicensed, unregulated, and unskilled providers, right? And some of them tried to do it themselves at home with a coat hanger or with douches of bleach. All kinds of things were tried. And so there were really high rates of complications from this, as you could imagine, and many, many deaths. In fact, during those decades, about 15 to 20% of all pregnancy and birth-related deaths at that time were due to abortion attempts. So there was a huge number of women who were significantly harmed by lack of access to safe abortion. So that video is part of your required media assignment for this week, and there are questions on the quiz that require you to have watched it. It's just 28 minutes and it's pretty good, so please watch that. All right, so what about abortion today? What's the state of things today? Well, Roe versus Wade was the 1973 decision by the Supreme Court that said that women had a right to abortion due to their rights to privacy and personal liberty. And so it must be legal before viability, which is usually 24 to 28 weeks. But the decision does not specifically state a time cutoff. And states can regulate it, right, based on the interests of the woman and the interests of the unborn. So what we see happening is that there are a lot of different state laws regarding abortion. So it varies tremendously from state to state. And some states have tried very hard to make it very difficult, if not impossible, for people to legally obtain an abortion. So especially in the last several years, we've seen lots of states passing very restrictive laws about abortion. And so what's happened is that most of these are getting struck down in the courts because they violate the Supreme Court decision, Roe versus Wade in 1973. However, these states keep passing these laws, they keep taking it to the courts in the hope that eventually they can work their cases up to the Supreme Court. So there is a significant movement to try to keep bringing these cases up, get them appealed all the way up to the Supreme Court in the hopes that the Supreme Court might overturn Roe versus Wade and make abortion illegal in the United States again. So that's the landscape we're in right now legally. So right now, abortion is legal and safe. It's still controversial, right? A lot of people feel that the fetus is a person, the embryo is a person, and it can be difficult to access depending on your state laws. So in the state of Wisconsin, for example, you must have an ultrasound performed during which the technician has to describe to you all the different parts of the fetus or embryo that they see. You also must undergo state-mandated counseling that is specifically designed to persuade you to not get an abortion. And then you must have a 24-hour waiting period. So this can be really difficult, especially if you're traveling a long distance. Most people live at least 2 hours away from their nearest abortion provider. So it can be quite difficult to access. The cost varies, usually a few $100s. So you may be surprised to learn that kind of the hero of the Republican Party in many ways, President Nixon, was the first president to actually enact federal funding to support Planned Parenthood as an organization. So you might remember that Planned Parenthood was the organization started by Margaret Sanger in order to inform women about birth control and give them access to birth control. Planned Parenthood also provides abortions, but that's not what President Nixon was wanting to support, right? He's saying no American woman should be denied access to family planning assistance because of her economic condition. So as we saw in the documentary, for those who were there, right, the ability to control when you have children is really important for the economic well-being of women. And so it's really important for your work life, for your career, for your ability to care for your other children. So the ability to not get pregnant is really important. So when we look at what Planned Parenthood actually does nowadays, the vast majority of their services are primary care and preventive reproductive health services. So contraception is still a huge part of what they do. So it's about 30%, right? 35%. They also do a lot of testing and treatment for STIs and a lot of cancer screening and prevention, things like pap smears and mammograms. Abortion services make up only about 3% of their total services. So when you talk about Planned Parenthood, you need to realize that the majority of what they're doing is providing reproductive health services and access to contraception for people who otherwise might have difficulty obtaining or affording it. I also want to point out that we do have at the federal level something called the Hyde Amendment, and that prohibits federal funding of abortion. So although historically the federal government has given monies via a program called Title X to family planning clinics to help them provide birth control at free or reduced cost to people who need it, abortion is funded completely separately through fees and private donations. So no federal money has ever in this country funded abortion services. And you could argue, well, why not? Because it's legal, but because this is such a contentious issue, we have this amendment. Now, just recently, a year ago, in the summer of 2019, the Trump-Pence administration passed a new restriction for Title X funding, saying that any clinic that accepted that federal funding could not refer their patients for abortion or give their patients any information about where to obtain an abortion. And so most Planned Parenthood clinics and many other family planning clinics are no longer receiving that money because they feel like it is improper. It's not correct care. It's not good care for their patients to not be able to fully inform them of their options. All right, so what are the options if someone was interested in getting an abortion? What are the procedures that are commonly performed? The first one is medical abortion, and by medical, this means you take some medicines, you take some pills generally, and that's going to cause basically the equivalent of a miscarriage. So about a third of abortions that occur before 8 weeks are done in this way. There's two medicines used. One is RU-486 or mifepristone, and this works like an anti-progesterone. And then that causes the endometrium to break down, and then the trophoblast, which you remember is the outer part of the blastocyst, which burrows into the endometrium, then kind of falls away and detaches, as well as misoprostol, which is a prostaglandin type medication, which opens the cervix and stimulates some uterine contractions. So with this combination of medications, the woman starts to have cramping and bleeding and will basically have the equivalent of a miscarriage over the next few days. As I mentioned, about a third of abortions that are done before 8 weeks of gestation are done in this way. It's kind of been increasing since 2004 when it was first approved. Other option is a surgical abortion. So this is using a suction device, usually a little tube like you see here, that's hooked up to suction to just kind of remove the pregnancy and that inner layer of the endometrium. It occurs in the office with local anesthesia. The patient is awake. You do have to open up the cervix, so sometimes they place some things ahead of time, some little expandable rods to do that, or use dilators during the procedure. The procedure itself lasts about 5 to 15 minutes, and at the end of the procedure, the pregnancy is over, and the woman usually has cramping for a couple days afterwards, kind of like a period. So when do women have abortions? I mentioned earlier that medical abortions were usually done before 8 weeks. And what you can see here is basically 2/3 of all abortions happen before 8 weeks of pregnancy. And if we include those that are done between 9 and 13 weeks, we can see that 90% of all abortions are done during the first trimester. So you may have seen a lot of really disturbing images of abortions done very late in pregnancy. Those are exceedingly rare and only done in the case of fetal or maternal health problems. So the vast majority of abortions occur when the embryo is about this size, right? So this is about a 7 to 8 week embryo. You can see the person's palm and a quarter there just for reference, and you can see the embryo. So very different looking, right? This is what abortion is like in the vast majority of cases, very different looking than other images you may have seen. So again, just kind of show you examples of what kind of sizes of embryos are we talking about, right? So usually before they are this big, and there's a dime that's scaled to kind of show you relative size. And even so, more than half of women say they would have liked to have their abortion done sooner, but it took time to A, make arrangements, and B, come up with the money. And for 1 in 10 women, it takes 2 weeks or longer to be able to make that happen, right? And given that sometimes you may not realize that you are pregnant until you're 4 weeks along, right, by typical pregnancy timing, which is after your last period, that can be significant. What about complications of the procedure? So overall, they're exceedingly rare. So the risk of major complications is less than 0.1%, right? Risk of death from abortion is about 1 in 100,000, so exceedingly rare. Minor complications like a mild infection or a little cut on the cervix, or a little bit of placenta or something left behind that they have to go back and suction out. Overall risk of minor complications is about 1%. So in the realm of medical procedures, this is actually exceedingly safe. What about emotional fallout, right? So what do we know about people's emotional well-being after an abortion? And actually, people have studied this. Most people who choose abortion, more than 90% of them feel like they made the right choice. So most people feel relieved. And in fact, if you look at people with an unplanned pregnancy who chose abortion versus people who chose childbirth, the people who choose abortion actually end up slightly better in terms of mental health than the women who chose childbirth. So, having an unplanned pregnancy is really stressful and puts you in a difficult position. And so there's always going to be some mental health fallout from that stressor. But what we find is that people who choose abortion tend to do just as well, if not better, than people who continue the pregnancy. Regret is really rare. But a lot of people are concerned about stigma, right? Worried that other people are going to disapprove of them, be disappointed in them, be angry at them. And so a lot of people keep it secret from friends and family. So overall, abortion rates are actually decreasing, but it's still pretty common. So right now, the statistic is that about 1 in 4 women will have an abortion before the age of 45. A few years ago, it was 1 in 3. So the rates are coming down, but it's still pretty common. All right, let's talk more about who gets abortions. So take a moment and kind of imagine in your head who you think the typical abortion patient is. What's their age? What's their relationship status? What's their financial status? What are the reasons why they may be choosing an abortion? So kind of form that picture in your head. And then we'll go through the data and we'll see how accurate your estimation was. So first of all, I just want to reiterate that abortion is really common, right? So a lot of people in this country who have uteruses end up getting an abortion at some point during their reproductive years, okay? So keep that in mind. Number one predictor, of course, of getting an abortion is having an unplanned pregnancy. No surprise there. Most people who plan a pregnancy are happy to be pregnant and will continue with the pregnancy unless there is a major medical problem with the fetus or the mother, right? So let's talk a little bit. So we're going to do a little side journey into talking a little bit about unintended pregnancy. It's really, really common. So in the United States, there are about 3 million unplanned pregnancies per year. About 1.5 million of those occur in people who are using birth control, but either weren't using it consistently and properly, or in rare cases, we're using it consistently and properly, but the method still failed, right? So as you know from last week, nothing is perfect. I've even had a patient who had an IUD in who got pregnant, right? This can happen. It's really uncommon. Of those 3 million unplanned pregnancies, slightly fewer than 1.5 million end in abortion. So again, I just want to reiterate this 3 million is almost half of all pregnancies in the United States. So almost half of all pregnancies in the United States are whoopses. This number used to be 50%. It's gotten better, but that's still really high. Okay. So it has decreased. Why? Right? So we're pretty sure it's due to increased access to contraception. So a couple of things have happened in the past 10 to 15 years. One is that the Affordable Care Act was passed in 2008. This made birth control available without out-of-pocket costs. This has had a huge impact on people's ability to access effective contraception. The other is that we're using the LARCs more, we're using the implant and the IUD more, and they are more effective, and they are not prone to user error, right? So remember, they're the get it and forget it ones, right? You get it put in your arm or put in your uterus and you're good to go. You don't have to remember to do anything anymore. but they're expensive, so you need insurance, right? So you see how these two things kind of worked hand in hand to significantly reduce unintended pregnancy rates. This is what that looks like. So right here is all women together. And you can see from 28, and this graph starts in ends in 2011, but this trend has continued, that we saw decreases in unintended pregnancy, most especially, right, steepest declines in those people who had the least income, right? So people who were lower socioeconomic status, again, right, they had been on an upward trend or stable until the Affordable Care Act was passed, and then we saw significant improvements. So along with that decline in unintentional pregnancies, then we have had a decrease in abortions. Makes sense. If you get rid of the cause of the need for an abortion, then you're going to have fewer abortions. So again, our best data shows that this is because of expanded coverage of contraception costs by healthcare plans, right? So the Affordable Care Act made that happen, as well as the increased use of the super effective long-acting methods like the IUD and the implant. So here's what that looks like graphically. So we don't have any good data before 1973, which is when abortion was made legal, right? Nobody was going to kind of cop to it when they could go to jail for it. So this is the rate per 1,000 women of reproductive age. So in 1973, it was about 16, and then it kind of went up quite a bit in the 1980s. Whether that was a real increase or improved reporting and data collection, it's hard to know. And then it has steadily been decreasing since then, more in some decades than in others. But you can see this really significant and historic drop in abortion rates ever since, Affordable Care Act, right? And access to really highly effective contraception. And so the rate of abortion now is lower than it has ever been since we've been measuring it and collecting data. So a couple things about unintentional pregnancy. So we talked about how insurance coverage is really helpful. We talked about how highly effective contraception is important. But I also want to bring up that the rates are much higher in states that have abstinence-only sex education. So one of your media assignments this week is John Oliver Tonight's episode about sex education in the United States. And you would think that if you're teaching kids to not have sex, that would be effective and they would have less sex and there would be fewer unintentional pregnancies. But in fact, when you look at the data, comprehensive sex education that teaches students about, well, if you do have sex someday, right, like maybe not tomorrow, but in 5 or 10 years from now, maybe when you're married, here are the ways that you can prevent a pregnancy as well as an STI. Those types of sex education programs actually result in lower teen pregnancy rates, as well as, interestingly, less risk-taking behavior. So it seems that once people really understand all the potential risks that are involved, it makes them a bit more careful. All right. So obviously, people who get unintentionally pregnant are the people who get abortions. But what else do we know about the statistics behind who are the folks who are getting abortions? So first of all, whether or not they're using birth control. Now you would think, well, this is kind of a no-brainer, but I just want to point something out. So this is a study from the Guttmacher Institute that studies unplanned pregnancy and abortion in the United States. And so in 2011, they did a study and they found that there's a small group of American women who are at risk of pregnancy. So they're having intercourse, but they're not using birth control at all. So those people ended up accounting for the majority of the abortions that occurred. And a lot of those people didn't think they would get pregnant, or they were worried about side effects of contraceptives. right? So here's some opportunities to maybe make things better here, right? And very few abortions actually occurred among the very large group of people who are sexually active but using contraceptives, right? And a lot of those folks said, well, I just have a hard time remembering to take my pill every day, right? As we know, most people do. It's hard to be a perfect user with some of these methods. All right, what are the ages of people choosing abortion? So again, remember that picture you had in your head of kind of the typical abortion patient, and let's see how you did. All right, so the vast majority of people getting abortions, so 2/3 just about, are in their 20s. Very few are actually teens, right? And then there's a small, about a quarter are age 30 or higher. So most people are in their 20s. This kind of makes sense because people in their 20s tend to be having sex more than people in the other age groups in general. What else do we know? Surprisingly to many, about 60% of people choosing abortion already have children, one or more other children. Only 45% are single, so more than half are married or have a long-term partner. So that also is different from what a lot of people expect. A very sizable majority live below 200% of the federal poverty limit. So federal poverty limit for an individual person in this country right now is $11,500 per year of income. So 200% would be $23,000 a year. So 70% approximately of people choosing abortion make $23,000 a year or less. Then we have religion over here. And we can see that these percentages are actually very similar to the percentage of the general population that is Protestant or Catholic. So as we saw before with birth control, how religious people chose to use it in equal numbers as people who weren't religious, we see the same thing again with abortion. So a lot of people may be opposed to abortion in general, but if it happens to them specifically, they often will go ahead and choose that for themselves, even if it's at odds with their faith. So most women who choose abortion are in their 20s or older, married or partnered, poor, already mothers, religious, and not using birth control. That is your typical abortion patient. So as we think about policies that we may want to enact about abortion, or in order to try to decrease the abortion rate, we have to keep these risk factors, such as they are, in mind. When they asked people why they were having an abortion, right, a lot of people said, well, I'm just done having children. But the most popular reasons are that they can't afford one or that they're not ready. Costs of raising a child are really significant, especially in the United States, where we don't have a lot of state or governmental assistance. So it's estimated to be over $200,000 from birth till age 18. There's time off of work for childbirth and recovery from childbirth. We are the only developed country that does not provide paid maternity leave. Some employers will provide paid maternity leave, but they do not have to. We do have something called Family Medical Leave Act, and if you work at a company with more than 50 employees and you've been there for 12 months or longer, you are entitled to unpaid leave. But that is the only requirement that we have for employers in this country. Then, of course, you have to house the child, feed them, clothe them. Diapers are ridiculously expensive, and then there's all the stuff that goes with. And daycare is a significant cost. So it is not unusual for the cost of daycare to be nearly equivalent to the entire take-home salary of the parent, right? In which case, well, then what are you going to use for rent and food and all those other things, right? So oftentimes people end up having to drop out of the workforce in order to be able to stay home with their child even if that's not what they would normally choose to do, but just because of the economics. All right. Raising a child can also be emotionally very challenging. So I will definitely say there's something to be said for being mature and ready for it. It can be one of the most difficult things you will do. And there's a significant loss of freedom and independence. It takes a lot of time. So if there's other things you need to be doing, it's not necessarily a good time to have a child. And of course, this can impact your career or educational path quite significantly, which has a huge impact on your ability to earn a high salary down the road. And so we know that a lot of people who choose abortion, it's because they simply cannot afford to have a child. All right, I'm going to talk briefly about the kind of the controversy here. So this is Americans' views about overturning Roe versus Wade. So what we can see in the dark green is that the vast majority of Americans, with some fluctuations from time to time, do not support overturning Roe versus Wade. They do believe that legal abortion should be available, perhaps with some restrictions, but that it should still be a legal option. And in general, about 30% of the population feels that it should be overturned and abortion should be illegal. So the argument for why it should be illegal is pretty straightforward. I alluded to this already. And it's basically saying that an embryo or a fetus is a person. So therefore, if you are ending that pregnancy, that you are taking a life, and they say that that's equivalent to murder. I cannot argue with that logic, right? But certainly 2/3 of the population of our country are not murderers of babies, right? They are people who feel like, well, it's not really quite a person yet, especially if we're talking about that 7-week embryo that's smaller than a dime, right? So we have this kind of difference in opinion about when personhood begins. This is a really interesting quote. The answer to a crisis pregnancy is to eliminate the crisis, not the child. Some would say not the pregnancy. And so this is important to think about too when we think about policy in terms of how do we support people in order to allow them to make certain choices rather than other ones. Folks who say abortion should be legal, again, obviously, they don't believe that an embryo is a person, right? But so they also point out some other kind of more pragmatic considerations in regard to whether or not abortion should be criminalized. So Sister Joan Chittister, I can never say her name, is a Catholic nun who's really active, and she says, I think in many cases your morality is deeply lacking if all you want is a child born, but not a child fed, not a child educated, not a child housed. That's not pro-life, that's pro-birth, which again gives us a lot to think about as we think about our social policies, right? So there's a lot of folks who kind of ascribe to this idea that, it's silly to devote a lot of time and resources toward protecting the unborn if then once they are born, we do not make sure that they have a roof over their heads, they have enough food to eat, they have good schools to go to, right? So that's this pro-life versus pro-birth argument. Other folks say, it's a woman's right to choose. It's her body, right? And in many ways, you could look at a developing embryo or fetus as a parasite, right? And just as we wouldn't force someone to donate a kidney to someone else, even though that could save the person's life, that we shouldn't force someone to carry a pregnancy to full term against their will. Or to become a parent against their will. There are other pragmatic considerations, right? So there are a lot of, unfortunately, unwanted children in the United States. More than 100,000 of them are in foster care and waiting to be adopted. 20,000 kids a year age out of foster care with no family, right? They are just forever orphans. So we already have more children than we are taking care of well in this country. And also, we were established on the idea that there should be this separation between church and state, right? It's one of the fundamental principles of the founding of our country. And so this idea that, yes, perhaps your religion says that this is a sin, but my religion doesn't. And in fact, many religions do not see abortion as a sin because there are many religions and philosophical traditions in which a fetus is not a person. So that idea of enforcing one religious view over another is problematic. And then finally, probably the strongest argument against criminalizing abortion is the safety argument, right? That if we make it illegal, that will result in unnecessary illness and deaths among people who are trying to end a pregnancy. And so these folks will say, Roe versus Wade was not the beginning of women having abortions because they were still having them illegally, right? But it was the end of women dying from abortions because once it became legal, we were able to have clinics where we have licensed and regulated providers in safe conditions providing this service. So as we kind of wade through this, and I said we weren't going to go into the morality of it, but I couldn't completely ignore it. Right. So first of all, would reducing the abortion rate in this country be a goal worth pursuing? And you can argue this lots of ways. I would say, in my personal opinion, the fact that a large segment of our population feels like it is morally repugnant. Certainly, if there are ways that we can healthfully reduce the abortion rate, that would be great. Some people feel like we shouldn't bother about that at all. And if somebody wants an abortion, let them get an abortion. And that's totally fine too. So then the second question is, would making abortion illegal actually reduce the abortion rate? And this is a difficult question to answer, and we'll get into that in a second. And if that can't, what else could? Okay, so we're going to kind of look at what could we do to prevent abortions in this country if we decided that was something we wanted to try to do. Okay, so how could we effectively prevent abortion? And this is, I'm sorry, I repeated the slide, blah, blah. Okay, so here's our situation. We have people who don't want to get pregnant who get pregnant, right? So the first thing that we could think about is how do we prevent this from happening, right? So that would be one strategy. Our other strategies, if our goal is to reduce abortion, would be to reduce the number of people with unwanted pregnancies who choose abortion, and to therefore increase the number of people who either choose adoption or parenthood, right? So how could we try to prevent the one thing, decrease the other, and increase the other two? Let's start with disincentivizing abortion first, because that is where a lot of the pro-life folks focus all of their energy and attention. So let's talk about it. There's already a lot of shame and stigma around unintentional pregnancy and abortion. And I definitely hear some people say, oh, we just need to shame people so that they won't do it. And the public health literature is actually quite clear that shaming people is not a good way to get them to change their behavior. And we already have a lot of shame and stigma. So we don't need to increase that. It's already opposed by lots of religious groups and political leaders, so there's already a lot of messaging out there to discourage people from getting abortions. And it's already pretty expensive and difficult to get. So we've already put a lot of hoops up that people have to jump through. So we've probably done as much as we can do in terms of, discouraging it already. So what about this idea of overturning Roe versus Wade and making it illegal? Would that be successful in actually decreasing the abortion rate? Well, so data from a 2016 study in Lancet, which is a major medical journal, they actually looked at countries where abortion was legal versus illegal and looked at the abortion rate, so number of abortions per 1,000 women of reproductive age per year. And they found that abortion rates were actually higher in countries where it's illegal, which is not what you would necessarily expect. Now, why does that happen? Well, here's the problem. This is tough data to get, right? When it's illegal. But in most of those countries where abortion is illegal, they also don't have good sex ed, and they also don't have easy access to contraception. So we have multiple variables that are different. In countries where abortion is legal, there tends to be more in the way of sex ed and more in the way of access to contraception. So there is currently in the world no country with comprehensive sex ed and very accessible, free to everybody birth control where abortion is illegal, right? That is the data point that we would need to know if making it illegal would actually be successful in decreasing abortion rates. So we also know that doing that is risky, right? So people who are unhappily pregnant will often do anything in their power to end that pregnancy, right? Especially if it means the ability to keep a roof over your head and your other children's heads and keep food on the table, right? So that we know historically when abortion is illegal, and in countries today where it is illegal, there are really high rates of maternal deaths due to self-induced abortions or going to unregulated practitioners. So there's a definite downside to pursuing the criminalization approach. So what about just preventing the unintended pregnancies from the get-go, right? Can we do that? Yeah, right. So if we have comprehensive sex education, we know that that decreases unintended pregnancies. And we have seen in our country when we reduce unintended pregnancies, we reduce abortions. It's actually the most effective intervention. So we need good sex ed, we need good access to highly effective contraception. So whatever method is going to be the right fit for that person, making sure that they have access to it, right? And we need a lot of public support and messaging around that, right? We need to not shame people for being responsible, right? And trying to do what they can to keep them and their partners safe, right? Sexual expression can be a normal, healthy, beautiful part of human life. And if people are going to do that responsibly, we should support that, right? Instead of trying to shame people about that. So let's say, okay, so imagine a perfect world where everyone who is having sex who doesn't want to get pregnant is on a highly effective form of birth control that they were able to get freely and they knew all about it because they had excellent sex ed. Even in that situation, right, no form of birth control is perfect. So unintended pregnancies could still occur. So let's kind of, how do we support those other two alternatives to abortion? So adoption is the one option. And we know that there are about 135,000 children who are adopted in this country each year. The majority of those are from the foster care system, but a full quarter of those are international, and about 15% are voluntarily relinquished infants. So only about 20,000 infants out of more than a million unplanned pregnancies, right, end up being chosen for adoption. So how could we support that, right? So if we think about like how could we encourage people to choose adoption, right, as their option if they have an unplanned pregnancy? One is make sure we provide really good healthcare and other support for the pregnant person, right? So financial support, social support, healthcare support, right? And then also, if you've ever known anyone who has become an adoptive parent, it's exceedingly expensive. So I have one of my best friends from growing up. She and her husband worked with an adoption agency, and they spent easily over $30,000 in the whole process, and are still paying money because they themselves are helping to financially support the birth mom. We can also look at how we fund that adoption process, and maybe it shouldn't all be on the adoptive parents because that makes it exclusive and only available to people who are wealthier. We also have to think about stigma and how we talk about abortion and what types of messages we give about abortion. So even think about the language we use, right? So oftentimes people will say, oh, she gave her baby up for adoption, right? Which kind of conjures this idea of you're quitting on the baby, or you're throwing the baby away, rather than she chose adoption for her child, right? She chose to give that child a life that was going to be better than what she felt she could offer, right? So how do we support that better? And so there's an extra credit assignment, which is to watch the movie Juno and to write about that and how it portrays adoption as an option for an unplanned pregnancy. All right. How do we make it easier for people who might be interested in parenting the child themselves, right? So going through with the birth and then being a parent to that child. So if we think about the reasons why people chose to not parent a child, most of them were financial, many of them, right? So how can we better, as a society, support parents so that it's not so financially devastating for them to choose to become a parent? What kind of childcare do we offer, right? So again, not only do we not offer paid maternity leave in this country, we also don't offer free childcare, which is kind of barbaric when you think about it. So maybe there are some opportunities there to make it easier to become a parent, right? What types of return to work options are there? In many countries, you are given 1 year of paid leave from your job with a guarantee that your job will still be there when you return from parental leave, right? How do we make it easier for people to be good parents and yet still be able to return to the workforce? How do we make it possible for people to perhaps work part-time while their kids are young, or do other things that actually support families? Right? So flexible work arrangements would play into this in terms of whether it's part-time or work from home or flexible hours. And how do we as a society support single parents, right? So a lot of folks, remember, more than half of people choosing abortion do have a partner, but about 45% don't. So how do we as a society support those people, both in terms of practical means, but also in terms of cultural support and emotional support? So in summary then, if we're serious about wanting to reduce abortions in this country, we absolutely need to reduce unplanned pregnancies. And we know that we can reduce unplanned pregnancies by improving sex education and by improving access to effective contraceptives, by making it easy to get, inexpensive, right? All of those things. We also then, if we're serious about this, we need to be serious about supporting parents, right? Especially those folks who are least fortunate, right? If we're really serious about this, that's where we can have an impact. We also need to think about how we support adoption as a choice and make that a more positive experience for the people who are choosing adoption for their child. And then I put this last one in really small text because we don't have good data to show that making abortion illegal would work at reducing abortions. You would think, well, certainly it would, but if you've watched that documentary, you realize that, like, as the one woman said, you take a woman who's unhappily pregnant and she will risk her life to end that pregnancy. Right? That same woman who, when she's happily pregnant, will risk her life to continue that pregnancy, right? But so we have to be really thoughtful about this because it may not actually work and it could backfire and cause excess harm. So that's it for the abortion lecture. And make sure to do those media assignments, and I will look forward to reading some of your answers to the questions. Thank you.